YouTube, Facebook, and all the other tech giants from censoring it. In fact, as soon as this is uploaded online, it will almost certainly be taken down and covered up for one simple reason. They don't want you to know the truth. But that doesn't matter because One American News is committed to exposing the truth wherever we find it. That's what journalism is. This program could be the most important 28 minutes of your life, and in fact, it could even save your life or the lives of your friends and family, and it's no conspiracy either. This information comes directly from doctors and healthcare workers, as well as the Centers for Disease Control, the CDC. We'll show you where you can find and verify this information right from the CDC's website yourself. And after watching this report, you'll discover that this lockdown and the hysteria over the pandemic is one of the biggest lies perpetrated on the American people in the history of our nation.
8 months. That's how long the United States has been in lockdown. As of the end of October, 8 long months. And listening to the people in charge, there's no end in sight. Democrats and the mainstream media insist that the coronavirus is the new bubonic plague and that Americans will simply drop dead if they set foot inside a business or dare to leave their homes without their masks on. Unless you're Nancy Pelosi or Anthony Fauci or Gavin Newsom or Lori Lightfoot or millions of Black Lives Matter terrorists and looters. So then, what truth is there to these bold assumptions made by our courageous leaders in Washington? One American News has been investigating this pandemic since it began. And after talking with doctors, medical scientists, and healthcare professionals, we can find absolutely no reason why the lockdown should go on even 1 day longer. Our businesses are ready. Our doctors are ready. Our workers are ready. It's time for the lockdown to end, and it's time for America to open up for business today. Back in March, when the lockdowns were first set in motion, they were based on the idea that the coronavirus was a new deadly pathogen that would kill millions of Americans. But as the months have gone by and we've had more time to study the virus, we've learned that's simply not the case. I spoke with Dr. Brian Tyson, a medical doctor who owns and operates a clinic in Imperial Valley, California, one of the COVID hotspots in the state. Dr. Tyson has successfully treated and cured some 2,000 coronavirus patients at his clinic and says the media is making the virus seem like a much bigger problem than it really is.
Yes, there are subpopulations that do have a hard time with it, but for the most part, it's not that bad, especially for those under the age of 40.
For evidence, we need look no further than the Centers for Disease Control itself, which is continually updating their website with the latest data on deaths attributed to the coronavirus. As of October 28th, 2020, there are some 230,000 deaths which are being blamed on the coronavirus. But let's take a closer look at those numbers and break them down, because when you do, something very interesting happens. By looking at this chart, and don't take our word for it, this is from the CDC itself, which you can see right here. We can see that yet again, COVID-19 is rarely the actual cause of death among coronavirus patients. According to the CDC themselves, of the 230,000 deaths attributed to the coronavirus, a huge number of them died from other causes, such as pneumonia and influenza.
88,000 had a diagnosis of influenza and pneumonia, including COVID-19. So did they die of influenza? Or did they die of COVID-19? Or did they die of pneumonia?
Another 19,000 died from chronic respiratory diseases. Chronic meaning conditions they had their entire lives and had nothing to do with coronavirus. 46,000 patients died from hypertensive diseases. 24,000 died from heart disease, and a whopping 40,000 people died from cardiac arrest and heart failure. Heart attacks, in other words. Yet all of these, even patients who died from strokes, were marked down as dying from the coronavirus. Doctors who spoke with One American News explained that over 130,000 patients who are being considered COVID-19 deaths already had life-ending diseases, including cancer, dementia, Alzheimer's, kidney failure, and obesity. However, most astonishingly of all, the CDC even counted over 7,000 patients who died from self-inflicted injuries, poisoning themselves, and even, tragically, suicides. Yes, people who killed themselves were marked down as dying from coronavirus. According to Los Angeles County public health officials, they admit that anyone who tests positive for coronavirus from the last 90 days and dies from anything, including heart attack or stroke, is counted as a COVID-19 death. They also acknowledge that this method, quote, could end up including some people who would have died even if they were not infected. And in Oregon, state public health officials said they count all deaths from anyone who tested positive in the last 60 days as dying due to the coronavirus. They said that even includes people who die in accidents such as a car crash. So someone who got coronavirus months ago recovered, and now they're driving along in their car to go to the grocery store when suddenly they crash into a tree and are killed by coronavirus. Following the CDC's current guidance, doctors only need to believe a patient died from COVID-19. No test required to mark coronavirus down as the cause of death. So we're not operating using science anymore. We're operating on a system of beliefs and faith. This is turning into a religion. Doctors also tell One America News that the CARES Act, passed by Congress in March, gives hospitals an additional 20% bonus for coronavirus diagnosis on their DRG, or diagnosis-related group, which is paid for by Medicare.
The CARES Act that Congress passed, if you added COVID-19 to the hospital death record, okay, then you got a 20% bump in the DRG. We know that. So if you died of a heart attack, and you died of pneumonia, or you died of a stroke, and we added that because it was a possibility because you had respiratory problems, but we couldn't test for it, so we really didn't know. But if we put those on there, then the reimbursement for the hospitals went up.
Essentially, that means doctors are being paid to list deaths as coronavirus without any indication that the patient's death was actually COVID-related. Furthermore, hospitals are being allowed to use presumed diagnosis for COVID death, which doctors tell us means that hospitals basically just guess if a patient has coronavirus and leave it at that. How many of those guesses are entirely wrong? And how many of those guesses earn the hospitals another 20% bonus from Medicare? The CDC backs these numbers up, actually explaining that the coronavirus itself is responsible for barely any of the deaths listed as coronavirus related. In fact, the CDC admitted in August that the coronavirus was the cause of death in just 6% of patients. The other 94% of coronavirus deaths are due to all those pre-existing conditions we just covered, cancer and heart attacks and so on. 94%. The CDC explained that nearly all of the people who have died from the coronavirus suffered from other serious illnesses and were also very old. If we add those percentages up, that means that of the 230 some odd thousand deaths attributed to coronavirus, just 13,000 of them died from the virus itself. The other 217,000 people died from other serious illnesses they already had. So unless you're an elderly person who has major health problems, the chances of dying from the coronavirus are extremely low. According to their own estimates, the Centers for Disease Control say that for children and teens up to 19 years old, your chances of surviving the coronavirus are 99.997%. Now you might say, well, we know children and teens do well, that's no surprise. Okay, well how about this? From age 20 all the way up to 49 years old, you have a 99.98% chance of recovering from the coronavirus with no problems. And for that critical at-risk population, those from 50 to 69 years old, you have a better than 99.5% chance of beating the coronavirus. With odds like that, who needs a vaccine?
We do not need a vaccine to open this country. We don't. Simply, plain and simple, we don't. All of the evidence shows you have a 99.997% chance of survival. If that's your chance of survival, what do you need a vaccine for?
More importantly, with odds like that, why are we still locked down? There's mounting evidence showing the lockdown is dramatically more harmful to the American public than the coronavirus ever was. Doctors explain that deaths due to unreported illnesses are skyrocketing, all because people are too terrified to go to the doctor and get help. People are avoiding cancer screenings, checkups on their hearts that would have prevented heart attacks, and other major diseases are going untreated thanks to the fear-mongering in the media.
Politicians are interfering with physicians such as myself by limiting what physicians can use to take care of sick patients. They're allowing people to die basing policies on information that's not scientifically proven. We do know early treatment works, and withholding that early treatment is probably one of the biggest crimes against humanity that we've seen in our nation.
The lockdown is having serious consequences on mental health as well. A new survey reveals young Americans are suffering tremendous levels of stress during the lockdown. According to the American Psychological Association, their Stress in America report revealed that Gen Z, Americans aged 18 to 23, has the highest level of stress of any age group in the nation. A staggering 71% of Generation Z Americans said they felt miserable and unhappy, while 81% of 13 to 18